Welcome back to the third video and chapter of this series where we're exploring strategies to increase trans inclusion in NSPs. I'll be giving you some helpful prompts and tips to identify common gaps in NSPs when it comes to trans inclusion. So I'm going to be guiding you using a template that you can find in the resource manual, which accompanies the activist guide. And in this video, we want to ensure that you know where to start when undertaking a detailed analysis of your country's NSP, looking particularly at trans inclusion. This is because an inclusive national strategic plan really sets up the adequate framework that helps us hold states accountable to their commitments. So it's important that when we look at a draft document or when we look at an existing document, we are being really thorough about it. NSPs, national strategic plans, all look a little bit different from each other in different countries, but generally they'll all still have the same kind of sections. The first types of sections that you'll find in NSPs are narrative sections, written sections that have definitions and language, usually a couple of paragraphs right at the beginning, an executive summary, or there'll usually be quite a bit of writing in NSPs. And there'll also be sections on epidemiological data. This is usually population studies, size estimates, and that kind of thing. When looking at NSPs, we can also find a monitoring and evaluation framework, a plan of some kind that's included in the NSP. And we also find activities that an NSP plans to undertake, as well as a budget. So when we're looking at understanding how our national strategic plans are currently addressing trans people, or what the gaps are when it comes to national strategic plans, the narrative section is the easiest section to look at, usually the first section that most people go to. And that's where we can start looking. Is there any language in the NSP generally about trans people, or are trans people only mentioned as part of another community? For example, perhaps under LGBT as an umbrella. Is there specific mention of the community, the trans community in particular? And where there is particular mention of the trans community in particular, and of course the specific mention that we are pushing for is because when you have that specific mention, then you're able to have more targeted activities. Whereas if we are subsumed under another community, for example, you might find that when it actually comes to the rollout, that trans people remain unaddressed. So a desegregated kind of approach is one that really helps us hone in on the community in ways that are most useful. So where trans people are included in the word transgender, for example, is used, is it understood as an umbrella term? Is there particular reference, for example, to trans women? Is there particular reference to trans men? In particular, for example, trans men who have sex with men, who we know face a higher risk. Is there thinking around the particular challenges for non-binary trans people or for trans sex workers? So when we're looking at the narrative of the NSP, we're not just looking whether the word trans is there. We're looking at whether it's mentioned in a context-respecting way, whether there's understanding of the diversity of the community. Even as we come to the document as trans activists, we want to make sure that we're not leaving anyone behind as we engage in this work ourselves. So we want to think really thoughtfully about our community. We want to look at the language and the definitions, for example, and that is used throughout the narrative. Are the words appropriate and non-stigmatizing? Where it makes sense and where it's relevant for your context? Is there use of indigenous or local or regional terms that resonate with the trans community in your area. The next section we'll talk about is the section on epidemiological data. Often a challenge in advocacy when we're working with states is the frustration around data, right? We're often told that there's a lack of data, that there's not enough data, and it's often used as kind of this big obstacle to getting anything happening. And the truth is that the National Strategic Plan is a really great place to get your state and to get the stakeholders involved really commit themselves to meeting that gap and that vacuum and planning to meet that gap in terms of data around trans populations. The NSP is where they can commit to undertake trans prevalence or population size estimates and those kind of studies. So this is a really important section because it's often a point of frustration in our advocacy. And the great thing about getting inclusion around data collection in your NSP is that when the state is involved in, there's often they are more likely to accept the validity of the data, of course. So it's worth really trying to get inclusion here. When we looking at data, we of course also still want to keep in mind the previous section. When we're thinking data collection, are we keeping in mind the diversity of the trans community and making sure that we're not leaving anyone behind? At the same time, one other thing we also want to look at is exactly how data will be collected, right? We know, for example, that for the state to reach trans people in rural areas or even in urban areas, often working with trans organizations is the most effective way to do this. It's also really good to think about whether data collection involves data validation with the community and whether it's planned in partnership with organizations. We always say nothing about us without us. And this is a place where we can certainly push for that. The next thing we'll be talking about briefly is trans-specific activities. So here we are, again, I suppose, looking for two things. Yes, that there's trans-specific activities that are for prevention, testing, treatment, retention, but also whether those activities are appropriate. So we heard in some pilot countries, for example, how important it was to address economic empowerment in order to ensure that there's greater adherence to HIV treatment, for example, because of the lack of economic resources being a real barrier to people being able to adhere to particular regimens. So we not only want to look at, is there a prevention activity, but is the prevention activity appropriate? Is it looking at tackling stigma and discrimination or a particular law or whatever it is that really is a barrier for the community when it comes to prevention? So we want to make sure that these activities reflect our priorities and reflect what we know needs to change in order to really have an impact on the lived experience of trans people on the ground. So we want to be really thoughtful around the kind of activities that are prioritized for the trans community. It's also a good idea, like in the data collection section as well, to think about exactly how will these activities be carried out, by who, and make sure that we are building accountability into this activity section as well, that we're building where we can collaboration into this activity as well. The next section I'll talk briefly about is monitoring and evaluation. An NSP will have a monitoring and evaluation section. And it's a really important section because it tells us whether the activities that we've been doing have actually been impactful. Are they working? Are we tracking them over time, not just at the end? Are we having points where we take stock? And are we looking at the appropriate things? So this again is a section that gives us the space to really consider, to have a considered approach to what is being presented to us there. The second last section I'll be talking about is the activities themselves. So we want to make sure that these activities are actually budgeted for, because a budget reflects priority. Where you put your money is where the priority is. We can have great inclusion in the activities, great inclusion in monitoring and evaluation and in data, and still come to implementation and be told that we would have loved to do that, but there's no budget. So we want to look really carefully at this section, that all the trans-specific activities that are mentioned are actually budgeted for, that the monitoring and evaluation activities, for example, are actually budgeted for. And we also want to look at how those resources are being distributed. So in places where there is inclusion and there is collaboration, is that also budgeted for? Trans organizations involved in working together with these different stakeholders to bring about these outcomes, will they be resourced in this work as well? So it's really important that we don't lose sight when it comes to the budget, and that we spend proper time really looking for trans-specific budgeting as well, because this is what will actually get the plan off of the ground. It's not the only way that you can look at an NSP, but hopefully it gets you thinking and gets you started and gets you a little bit excited about opening that NSP and thinking about putting together some kind of analysis and letting the state know exactly where the gaps are, where the best practices or what you really like about what's in the NSP when it comes to trans people. And if you're interested in learning more, please join us in the next chapter, where Nicholas will go into detail about how the actual NSP process works and what you can expect at each stage, so that you can plan your advocacy around this area strategically.